What is lower cross syndrome? So it sounds very fancy, but lower cross syndrome is a postural compensation pattern, and it's very, very common. It is often related to lordosis and also to an anterior pelvic tilt. But what I want you to do is just ignore those two words for now and think about a postural compensation that happens on a cross. So I want you to think about the body from the side. So imagine you're looking at a client from the side view. You're looking at the side of their hips and you draw a dot in the middle, right in line with the middle of their hips, sort of around their greater trochanter. So you have this dot in the middle of the hips, and then draw diagonal lines in a cross shape across those. Those diagonal lines have different properties. One of those diagonal lines is tight muscles. Now these tight muscles are overactive, usually when doing any movement at all, but also as a result of sitting down for long periods of time. So these muscles become overactive and shortened, which means they become very dominant in our movement control. And these muscles in particular are the lower back and the hip flexors. So the muscles in the lower back include the quadratus lumborum and the erector spinae, and then also the hip flexors. And these are pulling the body into this shifted position, which looks like an anterior tilt. And because muscles work in an opposing fashion, then you also have the muscles on the other side, which creates a diagonal line that is weak muscles. Now these muscles aren't necessarily not strong. They are more really relaxed to the point that they don't activate very frequently or very consistently, and they are the core and the glutes. So quite often, as a result of looking at this pattern, the main thing that a lower cross syndrome will teach you is that if your client has a anterior tilt whereby their hips are flexed slightly in a standing position and their lower back is flexed slightly, then when they're in this position, they need to stretch out the tight muscles and they need to activate the weaker muscles. Now the tight muscles, like I said, is going to be the quadratus lumborum, so the lower back, and the hip flexors. So do lots of stretch works for those. And then on the weak muscles, you need to activate the core and activate the glutes. Now this is the foundation of understanding how to work from a back pain point of view, but also it's a foundation for really postural control and understanding the patterns of the body. So if you notice an anterior shift in your clients whereby their pelvis is shifted forwards and pointing downwards, then this basically gives you a formula to be able to help correct it and also alleviate back pain as well. So that is what a lower cross syndrome is. If you have any questions, I'd love you to put those comments below. And if you haven't already hit like and subscribe, then please go ahead and do that now so you can catch up with all of our future videos as well.